Welcome to Marrow Masters, sponsored by the National Bone Marrow Transplant Link, Insight Corporation, and our esteemed Link partners. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplants from diagnosis through survivorship. This season of Marrow Masters focuses on chronic graft versus host disease, or GVHD. Here's your host, Executive Director of the NBMT Link, Peggy Burkhart.
Welcome, everyone. This episode will highlight a patient's perspective in regards to living with chronic graft versus host disease. At this time, I would like to introduce Sharde Fultz, who will be sharing her chronic graft versus host disease journey with us. Thank you for being with us, Sharde.
My pleasure. I'm glad to be here. Thank you.
Sharde, can you tell us a bit about your bone marrow transplant journey?
Sure. So I was diagnosed with non-Hodgkin's lymphoma in October of 2009. At the time, I was 20 years old, and I had chemotherapy treatment, radiation, and ultimately a bone marrow transplant. And that was in 2011. A lot occurred in between all that, but the best part, so to speak, depending on how you look at it, is the bone marrow transplant. So shortly after the transplant, I got diagnosed with chronic graft versus host disease.
Okay, can you tell us a bit about your markers for the match?
Sure. So I was about a 6 out of 8, and I had a allogeneic transplant. So that means I had a donor. Initially, we thought it was going to be an autologous, which is when they use your own DNA, but we thought I would have a better chance if I had a donor. So we went with the allo, which is much more riskier, but we took a leap. And thankfully, I got matched with my donor, Kevin Ratana. He's a Latino in New York, a really cool guy. And it's actually very important to mention that he's Latino because there are so few minorities in the bone marrow registry. But anyway, I got matched with Kevin, thank goodness.
What's your relationship, if any, with your donor these days?
We're actually really close. As soon as he was able to reach out to me after the transplant, he did. He sent me a really nice card with bracelets in it. And he couldn't say his name at the time, but he said, "I'm so glad I was able to help you out." Then once he was actually able to introduce himself, I got a phone call randomly one day. And he's like, "Hey, I'm Kevin, your donor." And I was still pretty sick and I was laying in bed like, "What? What's happening?"
That's amazing.
But right in that conversation, he said, "I'm just so happy you're doing okay. And, you know, we're brother and sister now." He sort of set the level of the relationship. So we've been in touch ever since then. We like to check in. He's started a family. And last year, I finally met him face to face, him and his family in New York. And that was really special. So I feel really blessed for our relationship. He's like a brother.
That's wonderful to hear. I'm sure it means a lot to him, too, to see you doing so well. And his gift of life made such a difference in your life. That's wonderful.
Absolutely.
Sharde, would you please tell us about your chronic graft versus host disease, your biggest struggles, tips, things like that?
Absolutely. When I think about the biggest struggles, that would probably be right after my bone marrow transplant. I got a very bad infection called C. diff, and it's basically when you get the wrong bacteria in your colon. So I had to get an emergency exploratory surgery. So this isn't directly a side effect of GVHD. I was still experiencing, early symptoms of that, but definitely a side effect of the transplant since I virtually had no immune system because I had just had the transplant done. So the surgeons were unsure about how to go about it, but they did an emergency surgery. And when I woke up, I had an ileostomy, which is an appliance that's attached to your stomach to sort of replace your regular intestinal system in layman's terms.
Sure.
So the C. diff was a major struggle because I was in a lot of pain. I lost a lot of weight during that process. After I recovered from the C. diff, which was a bit of a process in itself, I got a terrible case of GVHD in my lungs. My lungs collapsed a few times. So I ended up needing a procedure called pleurodesis, which is when they literally glue your lung back to the cavity. When the surgeons came in and said, we're going to glue your lung back, I looked at them like, what? That doesn't sound safe. You're just going to glue it. But apparently this is a normal procedure. So after that, I had to get a lot of pulmonary rehab. I was in pulmonary rehab for maybe a couple years. I had to carry around an oxygen tank. I would just be winded. I couldn't walk across the corner. Just going to another part of the house was exhausting. So that was definitely a rough time. And up to this day, I still have a lot of symptoms due to my, everything that my lungs have been through, the trauma. So I have a chronic cough and I still get fatigued pretty easily. So there's still, quite a few things to be dealt with even now.
Sure. Fatigue is something we hear a lot about. Has that been a big concern for you throughout your entire journey, or has it been as you're dealing with the chronic graft-versus-host disease?
I've had fatigue throughout the entire journey. Earlier, when I was in treatment, it was much worse. But now that I've been out of the thick of it for about 8 years, I'm a little more aware and able to pace myself. And even with work, I make sure my schedule is set in a way where I know I can get rest and take care of myself. But it's still there.
These coping mechanisms are so important, and especially when each person finds their own way to get through it, perhaps not overscheduling yourself.
Absolutely.
Things like that.
Yeah. It took me a while to get to that point. I was mainly frustrated, but I figured it out, and it really helps a lot to pace yourself.
Very good. What is chronic graft-versus-host disease like for you today, 8 years out?
It's still quite present. Thankfully, I've learned how to manage it very well. My oncologist and doctors have been walking through it with me step by step. So we've sort of learned how my body reacts to different things. Actually, very recently, yesterday, I had a bit of an emergency. I woke up and I thought I had pink eye, which immediately terrified me because pink eye for your everyday person is pretty horrible. But when you're immunocompromised, it's terrifying because you really have no idea how your body might respond. So I called my oncologist and the nurses said, maybe you should call your PCP. I haven't found a PCP yet. So they said to go over to urgent care. And I went, but unfortunately, urgent care wasn't sure what to do because with regular pink eye, of course, they know how to treat that. But I told them about my cancer history and my transplant. And so they said, we definitely don't want to do anything because we aren't even sure we can diagnose it properly. So they told me to see my ophthalmologist as soon as possible. That was a little disappointing because I was hoping I'd get some relief because I was so afraid. But I jetted to my ophthalmologist and he's like, Sharde, you're okay. It's all right. It's your GVHD. And I said, you're sure it's not pink eye? And the funny thing is, I didn't even realize it. But by the time I got to him, my eye had cleared up. But I was still like staring at him and near tears, like, you sure it's not pink eye? And not even knowing my eye's not even pink anymore. But he said that you're fine. It's the GVHD. You'll be irritated. And so it turns out that the symptoms of GVHD, even though I have it chronically in my eyes, dry eyes, itchy, and things like that, when it flares up or when it's at its worst, it sort of looks like pink eye, except he said, I'll know it's not pink eye if it's more dry and itchy pain than wet. Apparently, pink eye is pretty gross and wet, as most people know. So that's my go-to, because this has actually happened before, but it cleared up before I rushed to the doctor.
Well, and how wonderful that you're being responsible in making sure that it is what it is and that you then can treat it properly.
Absolutely. After all this time, I've learned one can't be too cautious. So I immediately called my job and I said, I'm sorry. They already know that I have health concerns, so they understand that it can be very unpredictable. So I called my job, I called my client, and I said, I'm just trying to look out for both of us. And everyone was very understanding about it. So I'd rather be too careful than end up in the hospital, which has happened before. So I learned my lesson.
Good. That's great to hear. And what exactly do you do for a living?
I'm a home health aide. I work for a company here in Michigan called Inspire Home Healthcare. I really love that job, but also I am a student studying human and family development, and I actually believe I'm going to switch over to social work. I think that's more in line with my passion. And in the summers, I work for a nonprofit in Boston called Next Step, and directly I work with a part of the program called Face to Face, which is for young adults with cancer diagnosis or who are survivors of young adult cancer. So we hold a weekend conference that is built around supporting them, empowering them, giving them knowledge, but also a chance to form a sense of community and support.
That's terrific. I'm sure they appreciate your background and your wisdom.
It means a lot to do it. And honestly, I only knew about the program because I went to it years ago when I was first diagnosed. So it really hits close to home and means a lot to be able to pay it forward, so to speak.
Can you tell us a bit about your support system? Caregiving is so important to our patients, and love to hear more about your support.
Absolutely. My family has always been very close, almost too close. At times, that's how it feels. But when I was diagnosed, they really just wrapped their arms around me, as well as my friends. So I feel really blessed to have had such a strong support system. I know a lot of people who can't say the same thing. And when I think about that, I'm just bewildered because I have no idea what I would have done. My mother especially basically put me back in the womb. There was so much I didn't even have to think about that when I'm in support groups, people are saying I was on this medication, that and that. And honestly, sometimes I'm like, I'm not even sure what all I was on because my mother was so hands-on. But I'm really grateful. Friends would come by and church members brought food. They would come clean my apartment. So I can't emphasize how much support I got from my family and friends and how much that lifted me in such dark times. Oftentimes when I couldn't feel happy for myself, they encouraged me and helped me press on. So I'm very grateful.
What a blessing. And being a young person when you were diagnosed, it's so refreshing to hear that you had that kind of support from friends. We know that AYAs, adolescent young adults, sometimes struggle having support systems when all their friends on a Saturday night are going out and figuring out what they're going to wear that night. And you're dealing with a life-changing diagnosis.
Absolutely. It was, in some ways, I felt this flood of warmth and love and support, but I can empathize. I did lose some friends, or relationships became a little more distant. And initially it hurt, but I spoke to, other friends and counselors, my family, my mom especially, and I learned everyone copes differently. And to be so young, it's hard to get yourself out of that zone and try to think from someone else's perspective, but it's daunting to even have a friend go through so much. So not everyone knew how to process it, and I had to be sensitive to the fact that this was hard for everyone. So again, I wouldn't have thought about that if I didn't have the people that I did have there. So, but I totally understand it. It shakes your world up quite a lot.
Absolutely. Do you have any other tips for coping? Perhaps meditation, exercise, things like that?
So I can't exercise as much with my lungs, but I do pray a lot. I pray all day to myself. And I have a lot of, they're kind of like mantras that I say to myself that I've heard over the years or that I've just learned in this process. For example, I embrace every day. I have to live in the moment and appreciate where I am right in this moment. Thinking about the past can be extremely daunting. And I know I just get into a spiral of dark sadness when I do. So I like to remind myself about where I am and how far I've come. And also, I really had to change my perspective on time, period, because I used to be very much so an A-type personality. Everything was planned. I was looking 10 years ahead. And now I've learned that time is, I don't want to sound too hippy-dippy, but it's really what you make of it. I was worried all my friends were going to be graduating and starting families. And I mean, even right now, I'm still pursuing my bachelor's. And I tend to struggle with that. But I've learned how to get through it and just acknowledge that we're all on a different path and a different trajectory, and just to appreciate where I am now, and that there's no cookie cutter way to go through life. So I have to repeat that to myself. It was extremely hard in the beginning. It was very depressing, but over time, I've been able to accept the fact that this is where I am, and I'm here for a reason. I was brought through a whole bunch of terrible stuff to be able to do what I'm doing now, and I'm really grateful. So again, one of my major coping methods is to appreciate where I've been, where I am now, and to not really worry about the future if I can help it.
That's terrific advice for all of us, regardless of anything. Thank you so much for that. Well, I'll have to remember that.
Oh, my friend Amelia told me this years ago. She said, don't trouble till trouble troubles you. And I have to tell myself that all the time, and it really does help.
That's a good one. I like that. What about being a young person regarding fertility? What were your concerns as you went through your treatment and post-treatment regarding possibly wanting to have a family someday, and how your diagnosis would affect that?
Well, the thing is, when I was first diagnosed, everything was in such a panic and hurry. It was, we have to get you into treatment. And they sort of threw some pamphlets my way, but we were more focused on saving my life. So I was not thinking about fertility at all. In retrospect, it would have been nice to have at least considered it, but I was just freaking out, honestly. So currently I can't have children. I didn't save any eggs or anything like that, but I don't want to be insensitive say it worked out, but I've never been the woman that was just waiting till I could have kids.
Sure.
And I'm not opposed to adoption. So I think it just sort of worked out that it didn't completely break my heart. I think what I struggled with most was being stricken of the option. I felt I had a right to decide if I wanted to, and I had a right to explore that in who knows how much time. And it was really stripped from me. So that was the hardest struggle. I was worried about, oh, well, what if I get married and my husband really, really wants kids, but that's a whole other conversation. But, there's a lot to consider and digest. And especially to be so young, this was something that I really was not thinking about. Again, I had this A-type personality, and the kids and the family weren't even in my purview at the moment. So it really took me aback.
Okay, that's understandable. One other question for you. Everything you know about chronic graft versus host disease, it's not easy. It's not for wimps.
True.
Would you do it again? Would you have the transplant? Would you do everything you've done to be here today?
Would I have the transplant again? Absolutely. And I say yes because I had the choice. And for me, the choice was presented as, you do this or you die. You could struggle and die later, or you could go through this really, really hard thing and you just might come out and be able to live whatever sort of life, is within your capacity. And so I prefer to live, but that's not everyone's story. And I really understand that some people want to embrace what they have in that moment and don't want to suffer. And there's a lot of suffering. It's really hard. So I honestly don't think there's a right or wrong answer. Oddly enough, I had to have this conversation with a friend who was struggling with that decision. And I just emphasized with her, it's a conversation mainly for you, a conversation for you and your family. And you have to reflect on exactly what you want in your life and how you want it. And so when it came to me, I felt I had already gone through so much. What's a few more years of fighting? And it was a gamble, but I'm happy I did it. And I truly would do it again.
Well, thank you so much. I'm sure this is going to inspire so many people. And we appreciate you. And we're so happy that you're doing so well.
Thank you so much. It's been an absolute pleasure. I just feel blessed to be able to say my piece, and prayerfully I can help someone with it. Thank you.
Thank you.
This has been the Marrow Masters podcast. Feel free to share this episode via social media, text, or email. To hear more, subscribe for free to Marrow Masters in your favorite podcast app. To learn more about graft versus host disease and the resources available to patients and caregivers, check out the National Bone Marrow Transplant link at nbmtlink.org. That's nbmtlink.org, or just tap the link below in the show notes.